Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case report on periapical pathology as seen in the CBCT scan. So basically patient was referred for a CBCT scan of the upper left side. So first we took a panoramic scout image of the upper left side and we noted a small periapical radiolucency in close proximity to the maxillary sinus. So we took a scout image and then a CBCT high resolution CBCT scan was taken for the upper left quadrant. So this is basically the CBCT scan of upper left quadrant where the tooth of concern, which is the premolar, is there. So the premolar showed presence of periapical pathology mainly on the palatal aspect, like palatal aspect or the palatal surface of the root. So what was the reason behind the periapical pathology? The root tooth gave a history of endodontic treatment, so root canal treatment was done already. So as we can see, it's a single fused root which is seen, but there are two canals present, so we can just adjust open the sharpness filter. We can hide these lines. We'll arrange the tooth along the long axis of the root and we'll just hide these lines and we'll just see there are two root canals, but the root canals seem to be fusing at the lower middle one third region. As you can see it in the axial cross sections also, they have fused in the lower middle one third region and then having a single exit. Okay, so this is the root canal fusion area and it has gone down. This is at the lower apical one third region and finally at the apical one third region, along with presence of lateral canal as seen. There is a lateral canal seen, and this dot which is seen is basically the apical one third region of the root apex region, and this is the lateral canal. So this is how it appears: the lateral canal and the periapical uh, root canal end. So we'll just adjust the contrast. Now we'll see the similar thing in smallest thickness, that is 0.00 mm. You can see this is the mesiobuccal root canal and this is the mesiolingual, or you can sorry, this is the buccal root canal and this is the palatal root canal. So the buccal and the palatal root canal, they seem to fuse to each other, but this is the point of fusion as marked. This is the point of fusion, but the thing is, like, this root canal performed is short of apex, or you can say underfill, which has caused this huge periapical radiolucency. So this is the root canal pathway which is there. This entire thing is the pathway of root canal system, and there is evidence of lateral canal exit as seen in the axial cross section. So you can just arrange it along the long axis of the lateral canal, and also you'll be able to appreciate the lateral canal as well. So this is the area of lateral canal where lateral canal may be seen, so you can just zoom that specific area to view the lateral canal. So this is the lateral canal region, and similarly you can see the lateral canal if evident in the periapical region of as seen in the sagittal aspects. So there are chances that this thing could be the lateral canal, this and this. So the root canal ideally has a single exit. As you can see, the the buccal and the palatal canal have been fused and forms a single exit, but there are chances that there may be some kind of accessory canal and lateral canal. So there are high chances that this is lateral canal and this is the main primary canal. Similarly, you can see the thing in different cross sections also. You can see it in 0.5 mm cross section as well as 0. Or 1 mm cross section also. So, this is seen in 0.5 mm cross section. So you have to increase the thickness or the sharpness and just check it once. Also, you can just check this thing in 1 mm, but it will be faintly visible, and hence it is highly advisable to view it in 0.5 mm thickness. We'll just arrange the tooth along the long axis. We'll note that there is periapical radiolucency as seen on the palatal aspect. There's the periapical pathology and there's the maxillary sinus, and you can see the palatal the buccal bone is mildly thinned out. You can see this is buccal cortical plate, which has, because of the expansion, there is initial thinning of buccal cortical plate. Similar findings, now we can see the findings in the axial CMPR view. So we'll just divide the tooth into smallest pieces. Okay, so this is the main tooth of concern. We'll just divide this interval line 0.5 mm just to check any kind of radiolucency or the radiolucent root canals. Okay, so basically this report usually says the root canal is short of apex, and you can also mark the pathology in the cross sections. Okay, so this is the periapical radiolucency which is seen, same findings, you can see it in dual CMPR view as well. You can just divide this thing into smallest cross sections and just with interval lines 1 mm and study the same, the root canal system, two roots, the buccal root and the palatal root, which have been fused to each other, and there's a point of fusion, and you can see this is short of apex. Okay, so there's a single root canal exit. Okay, not very well evident because the biomechanical preparation may not be completely done, because of which the radiolucency is not seen. And as you go apically, you can just check it or zoom the image. There are chances of lateral canal being present over here, so the radiolucency which is present. Okay, so this was everything about the endodontic assessment of upper left side, where patient had a pain. Patient complained of pain on the upper left side, and it's more likely because of the short of apex, which is kind of an endodontic endodontic treatment. Re root canal may be need is definitely required in this case. Okay, thank you so much.